All right, welcome to the deep dive. Today, we're going to go deep on something that I'm sure you don't think about very often, but you're using every single second.
Interesting.
Coordination, yeah. We're talking about ataxia. And
Yeah.
essentially, it's the loss of that smooth, effortless control that you have over all of your voluntary muscle movements.
Right.
And it can affect, think about it, walking without stumbling, picking something up without knocking it over, even talking clearly.
Right.
These are all things that ataxia can disrupt.
Absolutely. And the interesting thing is what we've gathered for you today is information from a whole bunch of different medical reports and overviews.
Okay.
To really try and give you a deep understanding of what ataxia is, it's not just like a simple thing.
Right.
It really goes deep into the core of how our bodies actually interact with the world.
Yeah, and diving into the medical world, it can be kind of overwhelming sometimes, right?
It can be a little dense.
It can be a little dense. But our aim here is to, pull out the most interesting parts. The most important parts make it easy to understand, so you come away really understanding, what ataxia is, the different ways it can show up,
Right.
what causes it, and how it's managed without, making you feel like you're reading a textbook or anything.
Exactly.
So let's get into it. What is ataxia?
Well, the first thing to really understand about ataxia is that it's not a disease in and of itself.
Okay.
It's more like a symptom, like a sign that something else is going on. It's kind of like your body's way of saying, hey, there's a communication breakdown happening here when I'm trying to move. So at its core, it's basically a disruption of that network that's responsible for those fluid coordinated actions that we all do every day.
That's a really good way to put it. A communication breakdown. So what parts of the body are actually involved in this, communication network?
Well, there are several key areas, and all of these are highlighted in the sources that we have. The cerebellum is a major player here.
Okay.
And you can think of it like the conductor of an orchestra. But the cerebellum doesn't act alone, obviously.
Right.
It has to work with other parts of the nervous system. So there's the brainstem and the spinal cord, and specifically a part of the spinal cord called the posterior columns.
Okay.
And the vestibular nuclei, which have to do with balance,
Right.
the basal ganglia, thalamus, even parts of your frontal cortex, which is involved in planning movement, and the cerebral white matter, which helps relay all those signals, and of course your peripheral sensory nerves, which are constantly feeding information back to your brain about where your body is in space.
Right.
So it's a really intricate and interconnected system. And like we said, if there's a glitch somewhere in that system, the cerebellum is often at the heart of the issue.
So if that communication, like you said, gets garbled, what are some of the causes of ataxia? What throws a wrench in the works?
We can look at those causes in a few different categories. One major category is problems that are going on directly in the central nervous system. So this could be something like a cerebellar infarction or a hemorrhage, which is basically a stroke that happens in the cerebellum.
Okay.
Or it could be tumors that are growing in that area. Multiple sclerosis, which, as you may know, is a disease that disrupts communication in the brain and spinal cord. That's another common cause. And then we have a whole category of degenerative diseases. And some of these have genetic origins. You might have heard of spinocerebellar ataxias or SCAs. And these are really a big group of inherited ataxias that specifically affect the cerebellum. And Friedreich's ataxia is a specific example of one of those. And infections like post-viral syndromes or encephalitis, those can throw things off as well. And of course, physical trauma to the head or spine.
Right.
So there's a wide range of things that can go wrong within the central nervous system.
Yeah, so we've got all that stuff happening inside the central nervous system. What about problems that are happening outside of the brain and spinal cord?
Yeah, you bring up a good point. Problems with the sensory pathways are another really important category. And in order to understand this, we need to talk about proprioception for a second, which you've probably heard of.
Yeah.
That's basically your body's sense of where your limbs are in space, even when you're not looking at them.
Right.
So if that feedback loop gets disrupted, it can definitely cause ataxia.
Okay.
Peripheral neuropathy, which is where the nerves outside of the central nervous system are damaged,
Right.
can also mess with this sensory information.
Okay.
And there are some specific conditions, like Taves dorsalis, which is linked to neurosyphilis, which is not something we hear a lot about these days, but is still around.
Right.
And even something as simple as a vitamin B12 deficiency can impact these pathways. It's really amazing how much we rely on these basic sensory inputs just to move around normally.
Yeah. You never really think about it, right?
Right.
Until it's gone.
Right.
So you mentioned one more category
Yes.
of causes.
So disorders of the vestibular system, which is basically your inner ear and all that machinery that's involved in balance and your sense of where you are in space. So things like Meniere's disease or vestibular neuritis, which is inflammation of a nerve in your inner ear,
Okay.
and even lesions in the brainstem that affect those vestibular pathways. All those things can result in ataxia.
So we've got all these different things that could be happening in different parts of this movement network, as you call it. It stands to reason that there must be different types of ataxia then.
Right. And we usually classify them into three main types,
Right.
depending on where that disruption is mainly happening. So we have sensory ataxia, vestibular ataxia, and cerebellar ataxia.
And each of those have their own signs and symptoms.
So exact.
Okay, so let's start with sensory ataxia. What's the key thing there?
Well, with sensory ataxia, it all comes down to a problem with that proprioceptive sense that we talked about earlier.
Right.
That sense of knowing where your body is in space. So the damage can happen anywhere along those sensory nerves, going all the way up to the medulla in your brainstem. And a key feature here is that someone with sensory ataxia will often find that their balance gets much worse when they close their eyes. And this is something doctors call a positive Romberg's test.
Why is that? Why does losing that visual input make such a difference?
Well, it's because, think about it, your brain has to rely on your eyes to know where your feet are and where your body is in space.
Right.
That's how important proprioception is. So in sensory ataxia, that internal feedback system is damaged.
Right.
So they have to rely more heavily on their vision to compensate. But when they close their eyes and that visual information is gone, the lack of proprioception becomes really, really obvious.
Okay.
And you can often see that in how they walk. People with sensory ataxia will often have this really deliberate high-stepping gait, almost like they're marching, and then they kind of slap their foot down on the ground. And that heavy strike is actually their way of trying to generate some sensory feedback through that impact and the sound. They also tend to walk with a wider stance to increase their stability. Now, interestingly, sensory ataxia is not typically associated with slurred speech or those involuntary eye movements called nystagmus.
Okay.
So you won't usually see those things. You often see sensory ataxia in conditions like neuropathies caused by diabetes, excessive alcohol use, vitamin B12 deficiency. It can also occur in MS and in tumors that are affecting that posterior part of the spinal cord.
Yeah, it's interesting to think about, how much we rely on these senses.
Yes.
That we don't even really think about until one of them is gone.
Right.
What about vestibular ataxia?
So vestibular ataxia, that stems from problems in that vestibular system, the inner ear.
That inner ear system.
Right.
That we take for granted.
Exactly. And this is all about balance and sensing movement. So with vestibular ataxia, people often have balance problems both when they're standing and when they're sitting.
Oh, wow.
They may stagger when they walk, and they tend to fall towards the side of the body where the problem is, or sometimes even away from it. You might also notice that their head and trunk movements are kind of restricted. And the interesting thing about vestibular ataxia is that it's often accompanied by vertigo,
Oh, yeah.
that spinning sensation.
Right.
You'll also often see nystagmus, those jerky eye movements, and even blurry vision, because that vestibular system is also involved in keeping your gaze steady. And the common causes of this type are things like Meniere's disease, a stroke that affects a specific part of the brainstem called the medulla. And again, like we said earlier, multiple sclerosis can be a factor too.
Okay, and finally we have cerebellar ataxia, and that's when the cerebellum itself, that conductor, or its connections are affected, right?
Exactly. So cerebellar ataxia happens when there's direct damage to the cerebellum itself or disruption of the pathways that connect it to other parts of the brain.
Right.
Now, unlike sensory ataxia, with cerebellar ataxia, the balance problems are present both with eyes open and closed.
Okay.
That's a key distinction. And one of the hallmarks of cerebellar ataxia is jerky, overshooting movements. And that's called intention tremor.
Okay.
So the tremor gets worse when the person is actually trying to do something to reach for a specific target.
Right.
People with cerebellar ataxia may also have slurred, almost explosive sounding speech, which is sometimes called scanning speech, where the words are broken up into syllables. Nystagmus is also common, and you might see decreased muscle tone, which is called hypotonia,
Okay.
and trunk instability, which is called titubation. And that can make it really difficult to sit or stand upright. There's often difficulty with those rapid alternating movements, like if you're trying to flip your hand back and forth really quickly.
Right.
It's called dysdiadochokinesia.
What a word.
Yeah, it's a mouthful.
Yeah.
But basically, if you have that, you have trouble doing those movements smoothly. Now, another important point is that if the damage is on one side of the cerebellum, the symptoms usually show up on the same side of the body. That's important to remember. And as for the causes of cerebellar ataxia, well, there's a whole laundry list. Vascular events like strokes, trauma, exposure to toxins, metabolic disorders, infections, inflammation, tumors, and even, as we mentioned before, a whole variety of genetic conditions.
Okay, so we've looked at a bunch of different underlying causes, the different ways ataxia can show up. What are we actually going to see in a person with ataxia? What are the clinical features?
Well, what you see really depends on which part of that movement network is being affected the most. But when it comes to balance and walking, you often see that wider stance that we talked about earlier, unsteady and irregular steps, more swaying or postural oscillation.
Okay.
They might struggle with walking heel to toe, and unfortunately, the risk of falls is much higher,
Yeah.
which has a huge impact on their safety and independence.
Yeah. That's going to be a huge factor
It is.
in quality of life.
Absolutely.
What about their ability to just move in general?
So there's often a lack of that smooth, fluid movement. It's called asynergy. And you might see them overshoot or undershoot when they're trying to grab something, which is dysmetria.
Okay.
And then that difficulty with those rapid alternating movements, the finger tapping thing. We talked about that, dysdiadochokinesia.
I feel like they need to practice saying that one.
It is a tough one.
Yeah.
But overall, their movements just seem slower and less accurate.
Okay, and we've mentioned tremor a couple of times. Can you talk a little more about that?
Sure. So the classic tremor that you see with cerebellar ataxia is called intention tremor.
Okay.
And it appears or gets worse when someone's actually trying to make a movement.
Okay.
But you can also see something called a postural tremor,
Right.
which happens when someone's trying to hold a position against gravity.
Okay.
And in some specific types of ataxia, you might even see other involuntary movements like myoclonus, which are those sudden muscle jerks,
Okay.
or chorea, which are more like dance-like random movements.
Wow. So ataxia affects speech and eye movement too, huh?
Yeah, so as we mentioned before, speech can become slurred, slow, have that explosive quality, and sometimes it's broken up into separate syllables. With eye movements, you can see something called saccadic dysmetria, where the eyes kind of overshoot or undershoot their target.
Right.
And nystagmus is also pretty common.
Right.
Those are those repetitive, involuntary eye movements.
So are there any other challenges that people with ataxia might face besides all this stuff?
Yeah, unfortunately there are,
Okay.
depending on the underlying cause and how severe it is.
Yeah.
So you can see things like dysphagia, which is difficulty swallowing.
Okay.
Some people might have urinary incontinence. Fatigue is a really common complaint, and that can be, pretty debilitating.
Yeah.
In the more progressive forms of ataxia, you can see cognitive and behavioral changes. And in some of the genetic ataxias like Friedreich's ataxia, skeletal deformities, things like scoliosis, a curvature of the spine, pes cavus, where they have high arches in their feet, those can develop, and in some cases even heart problems. So it really does go beyond just the movements.
So there's really a huge spectrum
There is.
of how ataxia can show up. Let's dive a little deeper into some of the specific types that
Yes.
you mentioned, both the genetic and the non-genetic ones,
Yeah.
starting with the genetically transmitted ataxias.
Okay, so among the inherited ataxias, Friedreich's ataxia is one of the big ones.
Yeah.
It's what we call an autosomal recessive condition, which means you need to inherit 2 copies of the faulty gene, one from each parent.
Right.
And the onset is usually in childhood or early adolescence.
Yeah.
So some of the key features you see with Friedreich's ataxia are progressive difficulty walking, limb coordination, slurred speech, or dysarthria,
Right.
loss of tendon reflexes, and something called Babinski's sign, which is an abnormal reflex in the foot. They'll often have decreased vibration sense. And then you can see things like scoliosis develop, heart problems, or cardiomyopathy, and those eye movement problems we talked about, like saccadic dysmetria. What's interesting is that often the underlying problem here is a mutation that affects the mitochondria, which are like the powerhouses of your cells.
Right.
And here's a surprising fact. Friedreich's ataxia is the most common inherited ataxia in Europe. About 1 in every 50,000 people are affected. And it actually accounts for about half of all inherited ataxia cases.
Wow, that's a pretty high number, I'd say.
It is.
What about ataxia telangiectasia?
So ataxia telangiectasia, or AT, is another inherited disorder. And this one is caused by a mutation in the ATM gene. And this is a more complex one because it actually affects multiple systems in the body.
Mm.
It usually starts showing up in early childhood. As the name suggests, it involves ataxia, so you get those coordination problems. But you also get telangiectasia, which are those tiny widened blood vessels that you might see in the whites of the eyes or on the skin.
Okay.
People with AT also have a weakened immune system.
Oh, wow.
So they're prone to getting a lot of respiratory infections, and they also have an increased risk of developing certain types of cancer.
Hmm.
So neurologically, the ataxia starts to become noticeable as the child learns to walk.
Mm-hmm.
They may develop speech difficulties, tremors, involuntary head movements, and eye movement problems. And unfortunately, many individuals with AT will lose the ability to walk independently by the time they're teenagers. And sadly, this condition often leads to death in early adulthood due to those infections or cancers that we talked about.
It sounds like a very, very difficult condition
It is.
to live with.
Yeah.
And the last of those common genetically transmitted ataxias that you mentioned were the spinocerebellar ataxia, or SCAs.
Right. So the spinocerebellar ataxias, or SCAs, these are a whole big group of inherited ataxias that affect the cerebellum.
Right.
And these are usually autosomal dominant, which means you only need one copy of the mutated gene to get the disease. They're characterized by a progressive ataxia. You'll see it affecting their posture, their walking, limb coordination, dysarthria, and those cerebellar eye movement problems, nystagmus, and all that. But what's interesting about SCAs is that they can also have symptoms that aren't related to the cerebellum.
Oh, really?
Yeah, so things like difficulty moving the eyes voluntarily, slow eye movements, decreased vibration sense, bladder problems, and sometimes even cognitive decline.
Wow.
Yeah, so it's a really complex group of disorders.
So those are the inherited forms. What about the ataxias that aren't linked to genetics?
Right, so the non-genetic ataxias often have a more sudden onset.
Okay.
Vascular events like strokes or hemorrhages that affect the cerebellum, those are a major cause in adults. Demyelination, which is the damage to the myelin sheath, the covering of the nerve fibers, that can cause ataxia as well. And that's
Yeah.
what you see in MS.
Right.
Tumors in the brain, infections, toxic or metabolic issues,
Like what kind of things?
like chronic alcohol abuse,
Hmm.
certain medication.
Okay.
You can also see something called paraneoplastic syndromes, where the body's immune system is actually attacking the cerebellum.
Oh, wow.
Yeah, it's a bit of a weird one, but it can happen. And of course, any physical trauma to the head can result in ataxia.
Okay.
So there are a lot of different ways you can get it.
Yeah, lots of ways to throw off that coordination, that's for sure.
Exactly.
So if someone presents with ataxia, how do doctors even begin to figure out what's causing it? What's the assessment and diagnosis look like?
Well, it all starts with a very, very thorough medical history.
Okay.
The doctor's going to want to know when it started.
Mm.
Was it sudden?
Mm.
Was it gradual? Is it symmetrical? Is it affecting both sides equally? How has it progressed? Is it getting worse? Staying the same? Are there periods where it gets better and worse?
Right.
They'll ask about any other symptoms, past medical history, any exposures to toxins, and really importantly, family history.
Okay.
So that can give you clues about possible genetic causes.
Yeah, so the physical exam, what's involved there?
So during the physical exam, they'll be looking at a number of things. They'll look at the person's posture, how they stand, how they walk, their gait.
Okay.
They'll look for any involuntary movements like tremors. They'll want to know, where is the tremor? What type of tremor is it? Does it happen at rest or when they're moving? When does it tend to occur? How severe is it? What triggers it? What makes it better?
Hmm.
All those things are important. And then there's some standardized assessment tools that are really helpful in objectively measuring how severe the ataxia is and also tracking how it changes over time.
Okay.
So two of the key ones are called the SARA, which stands for Scale for the Assessment and Rating of Ataxia.
Right.
And then there's the ICARS, which is the International Cooperative Ataxia Rating Scale.
Okay.
So these are just structured ways to assess different aspects of coordination and balance.
So you're actually looking at their balance very carefully.
Absolutely.
Are there tests for that?
Yes, because balance is so often affected, there are a number of specialized tests that doctors use to assess it. So you've probably heard of the Romberg test.
Yeah.
And the tandem Romberg test, where the person stands with their feet together, first with their eyes open and then closed, to see how much losing their vision affects their balance.
Right.
Other tests include things like the Balance Error Scoring System, or BSS, the Berg Balance Scale, the Tanetti assessment, the dynamic gait index, the functional balance scale, the mini best test, and something called the timed up and go test, or TU test.
Okay.
And this one is pretty simple. It measures how long it takes someone to stand up from a chair, walk a short distance, turn around, and sit back down.
Right.
So each of these tests is looking at different aspects of balance,
Right.
both static, which is when you're standing still, and dynamic, which is when you're moving. And in addition to all that, the doctor will probably also assess things like cognitive function. They'll do a cranial nerve exam, especially the nerves that are involved in balance and eye movements. They'll look at sensory and motor function, muscle tone, reflexes, coordination, and they'll do a detailed analysis of the person's walking pattern.
Wow, it's really involved.
It is.
And what about the diagnostic tools that help you really pinpoint the cause?
Right. So the advanced tools are really important.
Okay.
So MRI, magnetic resonance imaging, that's a really key tool here because it gives you those detailed pictures of the brain. So you can see things like cerebellar atrophy, which is shrinkage of the cerebellum.
Right.
You can see lesions, tumors, all that stuff. And if a hereditary ataxia is suspected, then genetic testing is really important to identify those specific gene mutations.
Okay.
And sometimes a lumbar puncture or spinal tap is done
Right.
to get a sample of the cerebrospinal fluid, and that can show signs of infection or inflammation.
Okay, so once you've figured out what's causing the ataxia, what can you do about it? What does the treatment and rehab look like?
Well, the first thing is you always want to treat the underlying cause of the ataxia, if you can.
Okay.
So if it's a vitamin deficiency, you give them supplements. If it's alcohol, you get them to stop drinking.
Right.
If it's an infection, you treat the infection, and so on.
Are there specific medical treatments for ataxia itself?
So while there isn't always a cure for ataxia, there are some medications that can help manage the symptoms.
Okay.
Muscle relaxants can be helpful if there's a lot of muscle stiffness or spasticity.
Okay.
Some drugs like gabapentin, clonazepam, or propranolol, those can sometimes help with coordination and tremors. But how well they work can really vary.
Okay.
And if there's an autoimmune component to the ataxia, then treatments like steroids, intravenous immunoglobulin or IVI, and plasmapheresis might be considered.
I feel like rehab would be really important here too,
Absolutely.
to help people with ataxia.
Yeah, physical therapy and rehabilitation are really the cornerstones of managing ataxia.
Okay.
It's all about helping people improve their mobility, their balance, and their ability to function.
Okay.
And a lot of experts believe that the earlier you start rehab, the better the outcomes are. So the main goals of physical therapy are to improve their postural control so they can stand more steadily,
Okay.
improve their walking ability so they can move around safely,
Right.
reduce their risk of falls, strengthen their muscles, and basically help them stay independent.
Right. And how do they do that? What kind of exercises and things are we talking about?
So they use a whole range of techniques,
Yeah.
and it's all tailored to the individual's needs and the specific type of ataxia they have. But balance and coordination training are really the key elements. So static exercises, things like standing on one leg, standing heel to toe,
Okay.
and then dynamic exercises, things like walking in a straight line, walking heel to toe, navigating obstacle courses, walking on uneven surfaces. They'll also do vestibular and proprioceptive training,
Okay.
which involves things like standing with your eyes closed,
Right.
doing specific head movements, that kind of thing. And then there's strengthening exercises for their core, their leg muscles, their arm muscles.
Right.
Gait training, which might involve assistive devices or using a treadmill. Dual task training, where they're doing a physical task and a cognitive task at the same time.
So like walking while, I don't know, counting backwards from 100 by sevens or something?
Yeah, exactly.
Okay.
And then there's functional movement training, which is basically practicing the activities of daily living that they find challenging.
Right?
You know, getting dressed, eating, all that stuff.
Yeah.
And then, of course, there are compensatory strategies, like teaching them to use a wider base of support when they're standing or walking,
Okay.
and teaching them about fall prevention strategies, how to make their home environment safer.
So occupational therapy and speech therapy are also really important, right?
Yes, they play a big role as well. Occupational therapy focuses on those activities of daily living,
Okay.
helping them maintain or regain their ability to do things like buttoning their clothes or using utensils.
Right.
They work on strengthening your hand muscles.
Okay.
And they might recommend assistive devices like weighted utensils to help with tremors or stabilizing braces to provide support. And then speech therapy. That's all about addressing the dysarthria, the speech difficulties.
All right.
So they might do breathing exercises, articulation exercises, and they might also work on dysphagia, which is difficulty swallowing.
Okay.
So they'll do exercises and also recommend ways to modify their diet to make swallowing safer.
Wow. So there's a lot involved here.
It is a multifaceted approach.
It sounds like a real team effort.
Absolutely. It takes a village.
Yeah.
What else can make a difference? So assistive devices and supportive technologies are really important. These can be simple things like canes and walkers, or they can be more specialized things like balance harnesses, or even voice-assistive technology if someone has severe speech problems.
Mm.
Nutrition guidance can be helpful. They might recommend an antioxidant-rich diet, avoiding alcohol.
Okay.
And of course, there are those fall prevention measures that we talked about for their home environment.
Right.
And then finally, we can't forget about the psychological and social impact of living with ataxia.
Right.
So things like counseling and support groups, those can provide really valuable support for both the person with ataxia and their family.
It's really interesting how the rehab approach might be, specifically tailored to the type of ataxia someone has.
Absolutely. So if you have cerebellar ataxia, where the cerebellum is the main problem,
Mm.
the goal there is to get them walking safely and help them be as independent as possible.
Okay.
So therapy might start by focusing on head and trunk control, and then it'll gradually progress to working on walking. They might use rhythmic, repetitive coordination exercises,
Right.
techniques like proprioceptive neuromuscular facilitation, or PNF,
Mm.
which uses these specific patterns of movement to improve motor control,
Okay.
and something called biofeedback, where they get feedback on their muscle activity.
Mm.
Now, because fine motor control can be a big problem in cerebellar ataxia,
Yeah.
using their hands for those detailed movements, the therapy will often start by focusing on the larger muscles
Okay.
and then gradually work down to the smaller muscles.
Interesting.
Yeah. So the exercises are often these slower, rhythmic, single-joint movements rather than those fast, multi-joint movements.
Right.
Physical therapy can also help manage pain, which can be a problem for some people.
Mhm.
And rhythmic neuromuscular training, specific balance exercises, and using assistive devices can all help with gait ataxia, those problems with walking.